Hey, gotta admit something. I used to think high blood pressure, that was like my grandparents' problem.
Hmm.
But then I saw these Heart Foundation guidelines, hypertension, clinical information, and guidelines, to be precise. And wow,
Yeah.
it's a whole different ballgame.
Yeah,
Let's dive into this
absolutely.
because there's some seriously important stuff in here about heart health for like everyone.
It's not just about age, right?
Yeah,
It's about understanding the risks we all face, even if you feel perfectly healthy.
exactly.
These insights are for everyone.
So let's back up for a sec. When we say hypertension, what are we actually talking about?
Okay, so simply put, it's the force of your blood against your artery walls, like a constant pressure.
Okay,
You want that pressure to be in a healthy range.
makes sense.
Hmm.
And the Heart Foundation, they're saying this is a big deal in Australia.
No. It's huge. It's the leading cause of cardiovascular disease here.
Wow,
And a lot of people don't even know they have it, putting them at risk for heart attacks and strokes.
that's scary. They also mentioned that blood pressure isn't just this one number, it fluctuates, right?
Right. It's dynamic, like your heart rate.
Okay,
Your heart rate isn't a flat line, is it? It changes throughout the day depending on what you're doing.
true.
Blood pressure is the same way. Exercise, stress, even time of day can impact it.
Speaking of understanding those numbers, the Heart Foundation keeps mentioning this heart health check. Is that really necessary, or is it just another thing to add to the to-do list?
It's definitely worth considering because it gives you a clearer picture of your risk for heart attack or stroke in the next 5 years.
Oh, wow.
And one of the things they look at is diastolic blood pressure.
Diastolic blood pressure.
That's the pressure when your heart is resting between beats.
Okay.
A high reading, there can be a warning sign.
Good to know. And it's interesting, these guidelines go beyond just diagnosis.
Right.
They have all this extra info, even for patients.
Yeah.
Why is that so important?
Because managing hypertension is a team effort. It's about informed patients working with their doctors,
Right.
understanding the why behind the advice, knowing your own risk factors. That's powerful.
So it's way more than just cutting back on salt.
Way more. This deep dive is just a starting point, encouraging everyone to pay attention to their heart health.
Definitely. After this, I'm thinking it's time for me to schedule that heart health check.
It's a good step.
How about you?
I'm due for a checkup myself.
Well, everyone listening, maybe it's time for you to take care of those hearts.
Your heart will thank you for it.